Did you know your teen's FND is not something they have to live with their life, like forever, like a life sentence? Despite the fact that many teens were told that FND is something they have to live with forever, but let me share the truth. If you're feeling hopeless or stuck, I want you to know it doesn't have to be that way. In this video, I'm going to walk you through why teen FND can be resolved and exactly what you need to do to get there. So let's dive in. For those who don't know me, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of online coaching program, Teen FND Academy. I have spent over 10 years in hospital settings working with patients who have had various medical conditions. And along the way, I became specialized in treating teens who are struggling with FND and chronic pain. So with my experience, many doctors mean well. I mean, they truly do. But here's the deal. Most are not trained in FND at all. I mean, I read somewhere in the statistics a long time ago that over 90% of the medical schools don't even talk about FND. So if you met with 9 out of 10 doctors in your encounter and then you are being told, well, we can't find anything there, so there's got to be your mental illness issue. It's got to be anxiety. It's got to be a stress. So you just go see a therapist. We don't know what's going on. You don't have epilepsy, so don't even think about coming back to see us again, that kind of thing. So you have probably been told that kind of things. I would call it symptoms without explanation. Your child is struggling and then you are thinking, that doesn't make sense. This is not normal. This is not my child. There's got to be something going on. So you just cannot abandon us. You just cannot make us medical homeless or medical reject. Now we're on our own and you have no clear path or no plan or no solutions that anyone can tell you. That is the majority of the families that I have worked with. Okay. However, the good news is the research and then real life results based on my own experience as well with a bunch of teens I've worked with show that with the right approach, teen FND can be resolved. I've seen it happen time and time and time again. So I'm going to walk you through how, okay? And the big thing is this is your teen. I specialize in teens who are struggling with FND. And unlike us, meaning parents, you and I, and other adults who are struggling with FND, teens, their brain is still developing. So your teen's brain is constantly learning and rewiring and all of that. So with FND, it's just kind of stuck in this wrong pattern, right? But it can be retrained, but it's not overnight one magic pill, one magic potion, or it's just one supplement that you take and then you're going to be done. It's much more complex than that. So you would have to learn the strategies and skills for your teen to retrain their brain and body. And that's why I created this methodology called the Brain for Teens. It stands for building resilience and improving neural health. So let me walk you through what that means exactly. So it's really a steps and methodology that I have been teaching, starting with what, and then onto the how, and then onto the why of FND. See, that's the thing. A lot of families are sort of stuck on this, bombarded with these questions and then quest about finding the root cause. Well, we've tried so many different things. We cannot find the answer. Therefore, we need to find the root cause of exactly what's going on, the why part, before we can do anything to help our child get better. Now, normally I would say, sure, that sounds like a great idea. In the FND world, here is what it would look like in that scenario. Let's just say I use a house on fire analogy a lot, so stick with me. So let's just say that your house is on fire. What do you have to do first? It's just so funny. Just totally side note. I used to say, like, if your house is on fire, you need to put out the fire, right? I mean, common sense. However, when I asked the teens about in the past, so what do you do if your house is on fire? They're like, you need to get out. You need to get out of the house. I'm like, absolutely, that makes sense. So since then I added the step. So if your house is on fire, you need to get out of the house, right? And then you need to put out the fire. Then you need to figure out what happened so that it doesn't happen again. Make sense? So far, so good? You follow me? In the earlier case scenario, it looks exactly like this. Your house is on fire. However, instead of getting out and then putting out the fire, you're staying in the house trying to figure out where that fire came from. Therefore, you're refusing to do anything until you find the root cause of the fire. Now, if you think about that in that context, does it make sense? Because if you don't get out of the house and then put out the fire, but instead you're focusing on, no, we need to find the root cause to find the best and most efficient way to put out the fire. Otherwise, we're wasting our time. Or the perfect example would be, we as a parent are ready to get out the house. However, our child is not willing to get out. So I feel like I need to just wait for my teen to ready to get out of the house. And in the meantime, yeah, maybe we're going to go down with the house. So if that is what you're experiencing, then really think about it. So there are so many different ways you can deal with the teen who is not willing to get out of the house in this scenario. And I have a bunch of videos on my YouTube channel about that. So going back to the Brain for Teens methodology, that's why you really need to know what you're dealing with, which is FND. That is not the same thing as any other illness or injury that is out there. That's why oftentimes FND is referred to as a symptoms without explanation. Although there is a clear explanation, but without knowing what that is, you would think this is mysterious, right? So what is FND? FND is a cross-wired network communication problem between the brain and the body. That's why structurally and physiologically, you can't find anything. But it is a real, and I know that your child's not making things up, because otherwise it would be so hard, right, to live like that. And it is not just one thing that is causing the problem. Again, going back to the root cause, guess what? It is a biopsychosocial phenomenon. And also there's a 3P factors. It's a predisposing factor, like what was cooking in the oven before the fire started, right? And then the precipitating factor, what triggered the fire to start of the FND, and then the perpetuating factor, what is keeping this fire of FND alive. So you all have to know all these things, but the why part, as I mentioned, comes later. So again, you need to know the FND is much more complex, but it's a communication network problem, and it is a real diagnosis, and it is very common diagnosis you would get in neurology clinic, even though you don't know anything about it, right? And unlike adult with FND, teen FND, the thing with this trauma is like less than half, if not less than a third of the case, depending on which research you're looking at, as opposed to adult, has something to do with the childhood adverse event, like trauma. So if your doctor is insisting that your child has had whatever trauma that you or your child don't know about, that is where it's coming from. Like I said, this is why working with teen FND specialists is non-negotiable. Otherwise, you are taking to a wrong path, knowing there's a dead end. And then you get frustrated because you're wasting your time and money and energy on that, right? So back to the Brain for Teens methodology. Now that you know the what, the bulk of my program is all about how. And it's not just one thing that your child can do. So for example, like the nervous system regulation strategies, that is the beginning of it. That is not all. So if you're being told the nervous system regulation is all I have to do, is then that's like, again, your house is on fire and all you have to do is just focus on your kitchen. As long as you put out the fire in the kitchen, the entire house's fire is going to go away. Not quite the case, right? But you got to start somewhere. Right? So usually autonomic nervous system regulation strategies, awesome. And you also have to have a goal, not just, I want to get better from FND. Well, I always ask our teens, when you get better, what do you want to do that you feel like you can't do? So you got to have some sort of North Star that you're looking forward to, right? Because things are going to be hard sometimes. It's going to be up and down, roller coaster, rocky road. So you're going to have that giant goal. And it can be small, but it's something you're looking forward to rather than people telling you what to do. And then we talk about how to get back to your life, because you kind of need to be active and then get better. Sort of at the same time, not the other way around. Again, you don't think about this. I can get out of the house when the fire is gone. If there's a fire, you need to get out and then put out the fire, right? And if you can put out the fire along the way, awesome. Same thing for your teen to get better from FND. Get active and then implement the strategies at the same time. So you don't wait until then. I was asked by one of the families not too long ago, what about chronic pain? Well, pain is so hard, so we kind of need to wait until the pain is under control, whatever that means, and then we can be active. Once again, chronic pain can be part of FND, so same formula applies here. You got to get active and then get better. So same thing. Then we also deal with the school. What to do with school? First of all, is there any plan put in place? And I have tons of videos about what to do with school on my channel as well. And then we have to deal with sleep. And all of these things take time, but they can go through the process. And then we can talk about why. Here's the deal. By the time you and your teen get to this why stage in my program, you and teens have tons and tons of skills and strategies built under your belt. Therefore, you can all deal with this potential why and then whatever comes out of it. So then you can put out the fire once and for all. So I had a lot of success stories here, but if I were to put one story, there was this teen who was 12-year-old when she joined the program, and she had not only FND, but she was also struggling with chronic pain. So she was a strong student, high-achieving straight A student who was also gymnast. And because of this issues of FND and chronic pain, she is out of the school, basically bed rest, forget the gymnastics, right? And then family was really desperate to help the child get better. So they found my program, went through the whole program of the Brain for Teens methodology. Guess what? Fast forward, she has no pain whatsoever, no FND whatsoever. She is back to fully integrated in school life and gymnastics. And then she recently got the MVP for the gymnastics club that she's in. So inspiring. Again, if your teen is struggling, don't give up. You can implement these strategies one by one because FND can be resolved and you and your teen can get your life back and thrive again. Comment below about your experience with Teen FND and watch other videos on my YouTube channel for tons and tons of more resources and practical strategies and steps that you can take today. And if you want more help under my guidance to get better, implementing this Brain for Teens strategies and within the community of Teen FND Academy, then click the link below to schedule a call to talk to me. Well, thank you so much for watching this video, and I will see you in the next video.